Solidarité is the motto of the French citizens when they speak of healthcare, a notion that all the French must stick together solidly to help one another in a time of need. They require mutual aid and cooperation among the sick and the well, the poor and the wealthy, and insist on financing health insurance on the basis of the ability to pay, not actuarial risk. If you took a look, the French system on the surface would look a lot like ours. Dig a little, and you find that insurance companies are non-profit entities, which of course saves money. Doctors and hospitals are paid within a week, and patients reimbursed for any expenses by the end of the month. Our insurance companies spend 20% of premiums on administrative expenses, while the French companies spend below 5%. There is no limitation on patient choice. All told, the French pay half of what we do for health care, and they cover everyone, including eyes, dental, hearing aids, mental health, and long-term care. The latter is paid in part by revenue from a once yearly unpaid working day, or Solidarity Day. Individuals may not opt out of the system. The employers pay for most of it, with the government picking up the tab for the unemployed. What most of us on the committee came away with, after reading the chapter on France in our book, was that each person has a card. It's called the carte vitale, or card of life, and it contains the patient's entire medical record. There is no paperwork. There are no files. When Jim, my husband, recently went for a medical consultation, the desk of the physician assistant was strewn with papers. He spent half his time updating Jim's records. All of this is missing in the French system. Instead, each time one visits a medical entity, the card is automatically updated. Hospitals are automatically paid, with subsequently 67% fewer administrative personnel. A doctor in France makes about a third of what a U.S. counterpart would make, but no French doctor pays to go to college or medical school, and malpractice insurance costs for a year equal what our doctors pay in a week. If one were to turn the page of the book, you'd find the title of the next chapter, Germany, Applied Christianity. They too use a similar card. The next time you go to a doctor's office and you fill out paperwork, checking off the 2-page list of items, and just start dreaming about these European systems. Solidarity, Christianity, whatever you like to call it, capitalism it is not.
The United Kingdom, universal coverage, no bills. I had to laugh when I read this title of one of T.R. Reid's chapters in The Healing of America. My job is as a broker for employers, medical and other group insurance plans. Several of the software companies I work with are U.S. offshoots of parent companies in the U.K. When I first meet with them, their jaws drop when I talk about the difference between HMO and PPO plans, co-payments, deductibles, pre-authorizations for certain procedures, and limits on certain procedures. Then, they are shocked when I explain that part of my job is helping employees resolve claims issues with their medical bills. Wait, they ask, HMOs, PPOs, co-payments, deductibles, pre-authorizations, limits, claims problems, bills? After World War II, the British created the National Health Service, their current successful single-payer system. The British people believed that a modern country must provide medical care to all, sick or well, young or old, rich or poor. Nobody ever pays a medical bill. The government pays for everything, including the education of doctors. Like France, UK doctors graduate debt-free. UK citizens do pay sales taxes of about 17% and higher Social Security and income taxes. Yet their minimal paperwork and administrative savings due to their no billing policy results in much, much lower healthcare costs. Despite these lower costs, they have lower child mortality, longer lives, healthier lives, and better recovery rates for major diseases than we do here in the U.S. U.S. detractors deplore the National Health Service as socialized medicine, a rather bad word to many people in this country. Yet, the U.S. has copied this UK model for tens of millions of Native Americans, for our military personnel and families, and for our veterans, government doctors in government facilities dispensing government drugs. If this model is un-American, why do we choose it for our veterans? In the book, when the author and his wife needed emergency treatment for their daughter's ear infection, and she was quickly and efficiently taken care of and comforted, they were surprised that it cost them absolutely nothing. At home in the U.S., they said they would have expected a $250 bill from the hospital, a $150 bill from the doctor, and about $100 for the lab technician. And they said they would expect a 3-month battle with their insurance company trying to get the bills paid. As they left the UK hospital, he and his wife quietly said, "Now we see why they pay 17% sales taxes." So I am of a value as a broker to my U.S. employers and their employees, as I see my job as educating them on how our system works and guide them through our crazy, wasteful, time-wise and money-wise policies. I take every opportunity I can when talking with HR managers and CFOs to educate them on other countries' healthcare systems and how their own companies and their employees would be better off developing a similar model. In the meantime, I'm there to help, but I should not be needed. I am surprised how many CFOs are telling me that they now agree with my view on national health care.
In his book, T.R. Reid makes 2 major points about the Canadian healthcare system. First, it is possible to provide medical care for everyone and still pay far less than the United States does. Second, a national solution does not have to start out on the national level. In Canada, children grow up with the story of little Tommy Douglas, who, injured in a football game, required surgery. His family could not afford it, and he was doomed to a life on crutches. Fortunately for Tommy, an orthopedic professor lived nearby and